This conference will now be recorded.
Being 7 o'clock, we'll call the Tilton Budget Committee November 16th, 2022 meeting to order. We'll start with the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we've been going kind of first come, first served. Who got here first? Franklin V&A?
Yeah.
Okay. So, tonight we have Selectman Scott Ruggles, Christine Dembitsky, Bill Lawrence, and Judy Tilton. So please come up. You must be, what's your name here somewhere?
That's okay. Hi, my name is Sherry Murray, and I'm
Sherry.
here from Franklin V&A and Hospice. Also here with me tonight is Jennifer Boyce, who's our Revenue Integrity Manager, and Kristen Albert, who is our CEO. We have been providing home health and hospice services to Tilton and the surrounding towns since 1945. In the fiscal year 2022, we provided a total of 2,120 home visits to the residents of Tilton, compared to 1,634 in fiscal year 2021, for an increase of 486 visits. We also provide monthly blood pressure clinics at the senior center, along with a one-time-a-year flu clinic. And we're also always willing to come out and provide any kind of education at the senior center that is requested. Effective in August 2022, we are now the preferred hospice provider at the VA home here in Tilton. We're here in front of you guys today requesting the town appropriation that we have requested and received the past few years in a total of $12,572. The reason why we're requesting the money is that we are a true nonprofit. What that means is we never bill a patient for their care unless for some reason they had a prearranged agreement with us in advance. That typically is for private duty services that are not covered by insurance and they don't qualify for any grants. If a patient has any, if their insurance has any kind of deductible or copay, we do not bill the patient. We then break that cost off as charitable care. Care for our patients, when we take a patient on, they are taken on based on their needs, not on their ability to pay. Sorry, I'm losing track of what I was going to say. What we've seen the past few years during the pandemic, and especially this past year, is we're getting sicker and sicker patients that are coming home to the community because hospitals are above census and they're short-staffed. So oftentimes the patients are coming home with home care and hospice services in order to relieve the pressure from the hospitals. What kind of questions do you guys have for me?
Anybody have any questions?
Probably.
We know you guys do a great job. I mean,
Thank you.
Every year though, I never agree with their proportion that we pay compared to everyone else. And we've been through this every year. So, but at town meeting, there's certain people that will bring it back. So no matter what we do, it's probably not, but I just don't, I feel that's not, and it's nothing against you guys. It's just that I feel that we're overcharged. But maybe you can tell me why we pay 22% of the entire town.
You mean compared to what our budget is yearly?
Well, no, on this budget here, just the amount that you get from towns.
Yep.
We pay 22% of that for 15% of the services. Yeah. But I mean, that's it, and it's been that way every year.
Yeah.
But we've been doing it for years and years. I'd just like to question that.
Yeah.
Why it's not more equalized.
So ages, I don't want to say ages ago, but about 10 years ago, the dollar amount was based on, it was a certain dollar amount per number of residents in the community, because at any point any of the residents in your community could come on service with us and we would provide care, no questions asked.
Sure.
So that's where the dollar amount came from. We haven't adjusted it, even though the number of patients in the community have obviously risen, and our number of visits have increased. We haven't changed the dollar amount. However, at any point, you guys can suggest something different.
Sure.
Because
I mean, I just did, like Franklin,
yeah,
they
so
get approximately 55% of services. They pay 48% of this money
Yep.
that you collect.
And we also get the Merrimack County gives us a grant that goes towards paying for care for the residents in the Merrimack County,
Okay.
and that's where part
Sure.
of it comes from also.
So if ours was based on per capita way 10 years ago, how did you, these are all 2,000, 2,500. That can't be per capita.
No, so the dollar amounts for the smaller towns throughout the years, the towns have come back and said, we can't afford the $5,000 we paid previously. We can only afford to give you $2,500 a year. So that's where those dollar amounts
Sure.
have come from.
Yeah. And that's actually what we did last year, but it was
Yeah.
changed at town meeting.
Yeah.
So, it's like Northfield, they're part of Merrimack County too. So
Correct.
they would be also a grant
Correct.
recipient.
Yeah.
But no, I think you guys do an incredible job, and we
you.
we need people like you, and local people. So, but we're a budget committee, so.
Right. No, we understand.
Are there any other questions?
Do you get any grants from the Belknap County?
We do not get any grants from Belknap County.
Do you apply?
I will be honest, we didn't apply. I didn't know there was one available in this fiscal
I don't
year.
know if there is
Okay.
either. Just curious.
I can look into it, but yeah, no, in previous years, there hadn't been a grant to apply for. But as far as if there's one for this coming fiscal year, I'd have to look into it.
You're good, yeah? Everybody? Thank you very much
Thank you.
for coming in. Yeah, we'll see you next year.
Have a good night, guys.
Yeah. Okay, who's next?
Granite State. Two Greater Lakes children. Sorry, my handwriting's a little, I apologize.
The newbie.
The newbie, so.
It's the Greater Lakes Child Advocacy Center, but you're part of the Granite State Children's Alliance.
Yes, yes, exactly. Good evening. My name is Megan Noyes. I am not Joy Barrett, as indicated on our
Okay,
application.
sure.
So she was unable to make it tonight due to a professional conflict. So I'm going to do my very best to represent and answer all the questions. I'm confident I can. I'm
Great.
fairly certain. Okay, to begin,
Go.
I know you have the applications in front of you,
Mhm.
but just to give kind of a brief background of what we do at the Child Advocacy Center. Most folks are not aware of us unless they've used us, and unfortunately, due to our work, most people don't talk about what we do. So we have served the town of Tilton since the year 2005 when we, the conception, and I've been with the organization since 2006, so I've had the opportunity to work with the town of Tilton for many years, specifically the police department when I referenced the town. And what we do at the Child Advocacy Center is we provide a multidisciplinary team approach to child abuse investigations within our county. So we serve all the towns, the city of Laconia as well. And when I say a multidisciplinary team, we work with our local law enforcement, so Tilton Police Department, as well as all the other police departments in our county, the Division for Children, Youth, and Families, our county attorney's office, and other partners in the area. And when a report is made to either DCYF or law enforcement, we begin to facilitate what we call a forensic interview of that child, of that report. And in addition to facilitating the forensic interview, which we do at our center, we also have expanded services since 2019, where now we have behavioral health services on site, which includes therapy. So we have therapists on site, and specialized medical exams twice a month that we host at our center in Laconia on Water Street. We are based on a national model. So if you were in New Hampshire, there's a child advocacy center in every county, but if you were in Florida, they're everywhere. Hawaii, they're everywhere. So we are based on a national model. And the reason why we are coming to you wonderful folks this evening and this year, unlike other years, is we used to receive funds from Belknap County. So that was originally we received county incentive funds many years ago, and that was to support our forensic interviewing program. And when I say supporting it, that was our forensic interviewer that it supported. And we did not receive those anymore. So we went to Belknap County and we did receive $20,000 for a couple of years. And then that was brought down to $12,000. And then the next year, 11,000. And what the county commissioners had said, our thought was to go to the towns at that point. And they had said, nope, we're going to do it this way. We'll go through the county and we'll just 1,000 per town and city. And unfortunately, we have been cut out of that budget. So we are now trying to diversify some of our funding in terms of approaching the towns in the city of Laconia as a new request. So that's what brings us here today. I can tell you over the last, since we opened, we have served over 200 children and their families in the town of Tilton. On average, we see about 10 to 15 referrals from Tilton Police Department a year. Right now, we're at approximately, I know when this was reported, this was numbers through August. So since then, we have seen 3 other children. So we're right around 10, 11 at this point in terms of how many children we have seen. And when I say we've seen, so what that entails is they've been referred to us. We provided a forensic interview. They were referred to specialized medical. We have 3 children who reside in Tilton right now receiving therapy through our therapist. And all of those services are free. They are not billed for anything. There is no insurance bill out. There's no cost associated at all. And there's no cost associated to our team members either. So the Tilton Police Department as well. So that's the 5-minute abbreviated version of kind of what we do.
Well, that's great. Yeah. Do you work with CASA at all?
So we're more in that first part of the phase. So CASA typically will come along a little bit later on. So we do work with CASAs, but not till later on in the process.
And approximately how many employees?
So the Greater Lakes Child Love Center, we are a program of the Granite State Children's Alliance.
Right.
So, but in Laconia specifically, so we have our program coordinator, forensic interviewer, who's Caitlin, and we have Andrew, our behavioral health clinician, and then a family support specialist, Michelle. So we have 3 full-time employees there, and then myself, my office is located there, but I do support the 4 centers that we operate, Keene, Nashua, Laconia, and Manchester.
So you only have that many people for how many towns?
So the just Belknap County. So that's just Belknap County, and then the other centers support. They have separate employees. The Granite State Children's Alliance has approximately 18 employees throughout it, with 3 and then a half myself there as well.
But in Belknap County, there's like what? Alton, Guilford, Gilmanton, Laconia, New Hampton, Samberton, Tilton, Meredith, and you only have that many people?
We do, yes.
Oh.
Yeah.
And how about the other mental health centers that are around? What do you?
Yeah, so we have a partnership with Lakes Region Mental Health. And so when I say we have a partnership, they come over monthly for case review, and we also refer to them. So obviously we only have 1 clinician who his caseloads, can get full. And the way that our behavioral health clinician works is to be able to kind of stabilize children when they come in, work with them typically for about 6 to 12 months. And then if they need a long-term therapist, they may go to Lakes Region Mental Health or a private practitioner at that point. So we're kind of bridging that gap, which we know as a state is a huge gap in services for children and families. So he's able to do that. And then we refer out if for whatever reason, he's a male too. So if there's, maybe that's not a good fit for a child, or if they're already established with a therapist, we'll ensure that they're, getting everything that they need. And we also work with a lot of other community partners in the area.
So is the Child Advocacy Center been here as long as the Granite State Children's Alliance?
So
Or they're the
longer.
same thing?
So they're essentially, just to give just some context so the Greater Lakes Child Life Center, we are a nonprofit under the Granite State Children's Alliance. When we opened, our fiscal agent was the Community Action Program, and that was in 2006. And we were located in Laconia, as we have been. And due to some financial instability and trying to combine resources, in 2012, we combined with our network of child advocacy centers, which was the Granite State Children's Alliance. So they essentially became our fiscal agent, and we became a program under them, as well as the Keene Center, Manchester, and Nashua at that time. So we have been around longer, but with the Granite State Children's Alliance since 2012.
and you were talking about grants, and typically, do you get federal grants?
We do. A large amount of our funding comes from the Victims of Crime Act. VOCA funding, that federal grant is where a good bulk of our funding comes from, our stream of revenue. State funding, we receive a small amount per center in the state. It is 9,000. So Belknap County will receive 9,000 through state funding.
This is only like 1 year of,
22 is at the end, and then 23 is in the beginning,
okay.
but it doesn't have income on it.
Yeah, it's kind of an abbreviated financials, and then you go to the Granite State Alliance. So I wasn't sure if it was actually an alliance, basically. And
So do you have our audit in there, our audited
Yeah, that's
financials?
from
you
Is
have,
that the-
21, not 22 or 20.
is that just Granite State of Children's Alliance, though, right?
Yes.
Audit.
Yes, yeah.
It's not your audit.
No, and the way that the Granite State Children's Alliance as our fiscal agent, so to speak. So Belknap County, all the funds that come into Belknap County and all the expenses are tagged within our county, so when it's broken down like that, I know in the audit it does not appear that way, looking at it that way.
So the expenses are broken down, but the income, we have access to the entire income, or are you only allotted whatever?
We're only allotted within Belknap County, what we're allotted specific to this county.
How did you come up with the 5,000 requests?
So in all fairness, I did not complete this, but I can speak just kind of the work, and even just when I was sitting here, I did prepare for this. We looked at the cost savings. And again, I know that there's this number that's been thrown out, this 1984 as 1,984 as cost savings per child. That is not just a number the Granite State Children's Alliance pulled. That is through the National Children's Alliance and the UNH Crimes Against Research Center that had done the study. There's a whole host of different things we could arrive, and I won't bore you with referencing how it saves. The 5,000, however, I would say to this committee, especially, I think making a recommendation that would make more sense. Again, I did not complete this, but I think, based on the numbers that we serve Tilton, and again, we'll serve if there's 9 or if there's 90 children, we would continue to serve no matter what. Basing it more around that specific number, that 1984, and having some method of calculating it, I don't know where the 5,000 came from, and I don't want to give you an incorrect answer. So I don't know.
Could you maybe get us?
I
like,
100%.
we asked for a comparative listing, what you asked other towns.
Yeah.
We don't have
You
that.
don't, again, and I was
So
looking
if
at
you
that.
could get us that,
I absolutely can. Yeah.
then we have something to talk
Yeah,
about.
I think, and I can get that to you by tomorrow. I can send it.
Okay,
Lisa,
sure,
would you
just-
want me to send that to you, Lisa?
Sure.
Yep, I'll send it to Lisa, so then at least it's, hopefully that will answer the question within
Yeah.
it, but we can definitely explain in a narrative too, like
Yeah.
where that 5,000 came from.
Can you explain a lot of things have gone up for 23, or estimated for 23. What is the reason? Because you don't have any more new employees. You only have 3 plus you.
Yeah.
And
So looking at the 2023, the thing, I see that the salaries have gone up, and that would just be the cost of living increase by that approximately 10,000. I can see that that's gone up. So I do know that there's been a cost of living increase in there.
is that every year?
Yes, generally, yep, every year, the cost of living increase. And then I just want to be able to speak out to the others. The administration, the CAC operations, that I believe is going to include those benefits in there, which are going to increase slightly each year as well. Payroll taxes, some of the other services that we use. So we have a database where we keep all of our records. We keep minimal, but we do have some records. So that I know that fee has gone up this particular year. Our equipment fees have gone up. So we provide, when police departments and child protection comes to our center, we give them a copy of the reporting. We do not maintain any of those records at our center. So that cost did increase this past year, and it will increase next year too. So some of those professional services, looking for any other substantial that might need a bit more explaining.
There's a column called percent of monthly spending to budget for budget fiscal year 23, which started July 1st, 2022. So your fiscal year is July 1 to June 30th.
Yes.
It looks like, I mean, we got 238% on supplies already
Yes.
for 23.
Yeah, so that did go up. So that would be our equipment, which we just had installed in September. Yeah, so that would explain that. There's a slight decrease in, or let's see, in looks like the salary may have, we didn't have somebody hired, we had somebody transition out, so we just hired somebody. So there would be a little bit of a difference in that as well. Occupancy, something like that, where that is up pretty substantial. We had to have we own the building, so we are our own landlords essentially. So we do have, we had some electric issues recently, so we had to have an electrician come in and fix everything in the center. And we also are part of a condo association on Water Street in Laconia. So we do have to pay into the association, and we've been paying substantially more for this chimney renovation with the Historical Society. So that is a cost that has increased as well over the last, and we anticipate will increase over the next year.
What was the monies you said you used to get from Belknap County?
So we started,
9,000?
we started with 20 with Belknap County, and it went down to 12,000. And then the following year went down to 11,000. And the formula for that, the commissioners used was 1,000 per town and city in Belknap County was that formula that they use.
So is the amount, we don't see the amount requested, but did they get the amount requested based on what they now are not getting, $11,000?
No, so this request is, so the last time we received county funds was approximately 2 years ago. And since then, since those 2 years, we have added the behavioral health clinician position. So that is, in the last 2 years, that is a new expense that we did not have when we received county funds. So that would have increased those expenses as well.
So if you added that and you didn't have these funds for the last 2 years, how did you supplement?
So we had a startup grant from that. So we had the Lois Dickerman grant, which funded the startup position for that particular position to be able to expand services.
And was that for both 2 years or 1 year?
2 years. Yeah.
And then there's no more?
No, and so that's kind of, here we are just trying to diversify some of our funding.
And how did you recoup the 11,000?
During that time, so we actually, we have a couple of fundraisers. One particular, our largest one in our county is Beards for Bucks. It's a local law enforcement puts on in October. And we typically would raise like 1,000 or so. And in this last year, not this past year, the year before, recouping it, we raised 15,000, or our local law enforcement raised 15,000. So that,
are they doing that again?
They did this past October, and they raised 10,000 this year, and that's an approximate number.
Okay. Really, you're looking to really cover this new position because there's no more grants, so to speak.
Yes.
Okay.
You only have one office?
We do, yes. So
In
yep,
Laconia.
right in Laconia, and we always are, if anybody ever just wants to see it, and again, whether or not, Tilton is able to support, I always, as a community member, I always say, people come and take a tour, just so you know, it's, it exists for everybody. It's a community building.
Great.
It's on 95 Water Street.
Yes.
Do you ever associate with the Belknap House?
We do, yeah. So we
Yeah.
actually, we have families and stuff that, yeah, we do.
Okay.
Yep. Lots of great programs in our county. We're
Yes.
very lucky. We're very, very lucky.
Thank you. Thank you very much.
And I will provide that information to
Great.
Lisa by tomorrow.
Thank you.
Thank you so much for having me. Take care.
Okay, Youth Assistance Program, Don, come on up.
That's fine.
How are you?
I'm good. How are you?
Good.
Hi. It's been a long day.
Yeah.
Maybe you guys feel the same.
Yeah, I feel the same way.
Feel the same. Okay.
Too much shoveling this morning. It's slush.
I live in Hill.
Yeah,
Native side.
Well, yeah, that's the good thing to do. Just let them know. I'm Dawn Schimberg. I'm the director of the Youth Assistance Program. I believe you're familiar with the program, and I believe we've met before.
Yes, yeah.
Yeah.
We were all here last year.
Yes, that's what I thought.
Right.
But I would also like to introduce Chris Enos. He is on my board of directors. He's also the principal of the middle school. And I'm not sure if, he said this was his first time here in the town office. So,
You don't want to come up and be tortured?
Nice, Christine.
Nice.
So yeah. So I can tell you a little bit about the program and what we've been doing. We are doing the juvenile court diversion program as usual, and that's been pretty busy. We have our educational programs. Positive decision making is one that we use frequently. We also have anger management, our violence prevention program. We're doing some things in the school and do the Courage to Care. We're going to be asked back to do the law and youth and the law, and we do that with the 8th graders, as well as some experiential games that we play with them to help them kind of imagine what it would be like to keep all of the things that they have juggling in their lives, and then add into that somebody in their family who has a substance misuse disorder and how that might impact things. So one of our newer programs that I'm really excited about is our leadership program. And we are holding that at the library. And we're doing it with a wellness coach, which is Jen Adams, who you may all be familiar with. Jen, she's also the director of my board. And so I'm really excited about that program because I have a couple of young people who I'm working with under juvenile court diversion contracts who I do believe have that leadership ability there somewhere, and you can see it. Some of them are a little too quiet and they don't think of themselves as leaders. Some of them may be leaders, but maybe leading in the wrong direction. So maybe we can help. So, and we're running that on Mondays. So those are some of the newer things. I do have a little like addendum to our request. So I'd like to pass that out when you guys are ready to see some new figures.
Sure. Do you have a different paper for us?
I do, and I kind of put it like, I put the new figures like on a cover sheet type of thing, just so that they'd be easy to access. What happened is we were able to reduce our health insurance line. So we will be deducting, I think it was 1,988 from our request. Okay, so it's really just new figures, but they're going in a good direction.
Oh, yeah, that's great. As long as you're still getting what you need. Yeah.
Yes, we are.
So Northfield gave 0 last year, or is this what you're requesting this year?
I'm
Total
sorry.
budget?
What's that? Yeah, Northfield was very complicated last year. Okay, we are requesting.
I saw what you're requesting for 23, but this
Okay.
is 0 here, so it must have been 22.
Let me see what you're looking at, Christine. I do have it here with me as well.
This is by the school formula. Our
Yes,
Tilton
yes,
Northfield
it is by
shares, right?
right. So it changes a little bit each year
Right.
as the school composition
Yeah.
changes.
That just
Oh,
is
yeah. No, they did. Okay, this is what happens with this, is that at the time that this was done, and this was June 30th, they have changed the way they disperse their appropriations, which is really difficult. But so now they give the first disbursement in July.
Oh, okay.
And then they give the
Oh.
second disbursement in December. Okay, so yeah, you scared me too. It was like, oh no.
Downstairs at the TMFB.
Okay, yeah.
She's like, see me, Chloe, she's coming.
Do you anticipate any big changes for the next coming year? Anything? Looks pretty stable.
Yeah, it feels pretty stable. We do still have the state grant that we will renew and apply again. We will apply in usually it's May. Okay,
Oh,
so and that is on the fiscal year. So we still are receiving it up until the end of June. So and that amount to you guys would deduct off of the appropriation $8,389 for the first half of the year.
So you'll deduct 8,000 something off of 47,540?
Yes. Okay, and then we
8,000, what is it?
$8,389. Okay, and that's already, we've been working under that, well, we've had the grant for 3 years, which has been really helpful. And so this is the last time it was awarded, it was a 2-year grant, and so it will be winding down, but we will reapply in the spring. Okay, and my understanding is that the state is really trying to support, youth programs in the communities because they have been changing the juvenile justice statute to really funnel more children into diversion and away from court.
I just want to be clear, so now is the request now 39,151 minus the 8389?
The state really, it's all reimbursable. So they will pay us back, but there's this little addendum that says if these go away at any time, so we always ask for the appropriation info
Okay,
and then
you'll
then
reimburse
we-
later.
we take it off. Yeah, so we take it off when we bill. So when our invoice, it's taken off. Okay, and so thankfully the state hasn't taken that money away, but that's the thing is that they could conceivably do that.
And we did that last year?
Yes. Hi, Catherine, here I'd like to get you yourself situated. But I did say that we had some new figures because we were able to reduce the line item for health insurance. Oh, so we're asking for $1,980 less.
Are you fiscal year or calendar year?
Calendar.
Have you been doing many JRB processing?
It's been picking up.
Has it?
Yeah, it was hopping for a while. And I did, I mentioned briefly the educational programs, but we are quite busy with our vaping education program and the substance misuse program, so which is challenge. So yeah, so we're still doing that work as well.
And what's the age that you're generally working with these days?
Bill, mostly it's middle school and high school.
Okay.
Okay, I mean, we occasionally get a younger child, but not usually.
Yeah.
I think our program is geared more for the middle school and high school age.
So you started a new program or is it gonna start at the library
It has started and we're doing it on Mondays and it's leadership. It's called Leaning into Leadership.
And those funds just came out of your excess monies that are sitting there, or how did you pay for it when it first started?
Okay, it was actually. Okay.
Somebody logged in.
Okay, all right. It's like, oh, maybe I should rephrase that. It's like said something wrong. Okay. No, it actually came about as a grant came across. I received information on a possible grant that I wasn't able to do a whole lot with, and I spoke to the library about it. And so together we worked on doing this grant. So my piece is the leadership program where they were able to do more with the library, like I think they did some stuff with a cooking program and things like that. And so our piece is the leadership. And so it came from the grant from the library. And then my being there is part of the youth assistance program.
Okay, so the library's got the grant, you guys didn't get the grant.
Right.
I mean, it's still holding a good balance.
Thank you.
How do you get into the leadership program?
You have to know someone, Bill.
I might need it, you know.
No, actually, at this point, I think we would take any interested young people. It's not like a year-long program.
Mhm.
We're going to do it in probably like 6-week sessions. So if you're interested, you can join and be part of the leadership group for 6 weeks. You have to be sincere, though. You can't bring all your buddies and hoot and holler around and everything. Okay, it has to be sincere. And then if you want to, you might want to stay with it. That's fine. If you don't, that's okay. And then we'll do another 6 components. And and again, like I said, it's really good because right now we have 3 in this group. So this is our first group. And so we're still inviting more people. And the 3 are 3 unlikely teams that you would think would even like sit
Mhm.
together. So they're very unlikely. And so it's an amazing group because they're talking and sharing and there's just so I really like it because I mean, there are young people who are great leaders who do a lot of things and their calendars are pretty full, and then we have a lot of potential that I would like to really bring out. And so kind of form those bonds with groups that, this person, might be somebody who's never gotten in trouble in his or her life. And this person is somebody who's really struggling to get out of trouble. And this person is, young and, this is probably maybe the first time he or she spent time with high school students, so it's interesting.
It's good for the future.
Any other questions? None? Great. Thank you.
Thank you all for meeting with
Thanks.
me.
Yeah,
Thanks.
thank you. All right, so now we're off to minutes.
You missed the new program.
The what?
There's a new program. You'll have to listen to the tape. The new one we had?
Oh, the new,
Yeah.
yeah, I'm not a fan.
We, definitely answered the question.
Huh?
As far as you really feels.
Yeah, right. Okay, so now I've got minutes from November 2nd, 2022.
Make a motion to approve the minutes of the November 2nd, 2022 meeting as written.
Any discussion? Anybody need more time?
No, my name's spelled right.
All those in favor, say aye.
Aye.
Any opposed? The ayes are unanimous. We were going to get something from Sandy Hislop, right? Is she going to give us a one-year look, profit and loss statement from
Did I,
CASA?
is that one of the ones I,
She sends 2
I
things
sent
by
it to you.
email. I didn't print them though.
let me just check.
Did we get that?
I forget which one I sent to you. 'Cause there was 2.
Well,
right?
we got one from the Pines,
Yep, Brittany sent.
and it says here the budget committee had some questions for Hislop and asked for the email of secretary the following information. A one-year look, as they were only given a 1-month look at their budget, and a profit and loss statement.
Yeah, I sent you what I got, so I didn't get anything back.
So we haven't got from anything in them yet, okay.
Lisa, are you able, do you have this report? I think we got it last year, so you would have had it, right?
Yeah, and there's one that I keep in the, Google Drive too, that an updated one. So.
What is that?
It's to show what people requested the prior years and what we gave.
Oh, okay.
Can you email it to me then?
Yeah,
I didn't see it.
I'm gonna go in and update it.
Mr. Chairman, just a note from Lockmere Water District. It's been a long day today. But Selectman Jessman just reports back that the budget is finalized. Their treasurer was in contact with DRA today, but they still have to take a final official vote to approve the budget, and then they'll have it to us.
Okay, great. Great, thank you.
Yep.
Do they think they'll be able to come on the 30th?
I'll ask Joe tomorrow night. One question a day. We'll go with Selectman Jessman.
Do they understand that we can change their budget?
Yes.
So they don't want to report the budget they've approved to DRA, because that may not be the budget that they get.
Didn't we go through this last year with them? I think.
I don't know if he understood.
Yeah, I'll let Joe.
He's a great guy, but I don't know if he understood.
I'll let Joe know.
So the 30th, we have CAP and potentially the water district.
Yes.
And that's all we really have for outside agencies, right? So then we can really concentrate on the town after that.
Yeah, Tim said he was gonna email us that, right? Or get that to us?
I think he was going to update his report. I haven't seen it yet, right?
Yeah.
Not yet.
He should have it already, but he was gonna present it, I think, sometime in December. Because he's not gonna be here on the 30th.
Oh, that's right.
Okay, right. But if he wanted to get us if the report is done, if he could get it to us earlier so we could peruse it, would be great.
And he was downstairs today, so.
He was up here
He's
for a little bit.
listening.
Hi, Tim.
Hey, anything else? If not, we can entertain the motion to adjourn.
Motion to adjourn.
Seconded.
All those in favor?
Hope everyone has a happy Thanksgiving.
Yes.
They just found out it was next week.
I know.
I mean-
I said the same thing, like.
I know.
I mean, we're over halfway through November already.
Yeah, how could that
It's
be?
hard to,